Coming to you live from PRS View Studios, this is your Plastic Surgery Minute. Hi, I'm Rod Rorick from PRS View, and I'm honored to have one of my good friends, Dr. Daniel Cassuto, from Milan, Italy. Great to see you. And
Likewise,
thank you for
Rod.
making the trip.
It's my pleasure and honor.
It's great. So, of course, Daniel's a superb plastic surgeon, but he also has an incredible expertise in cosmetic medicine. So, tell us, why would a patient want fillers today?
Actually, there's a language barrier here. The word filler has become a bit misleading.
Okay.
It sounds like something that is put in there to occupy space. Today we know that especially hyaluronic acids, but also other resorbable substances, actually have a very important role in enhancing tissue quality, exactly like fat.
Okay.
So today we aim more at curing tissues, improving their quality, something we can't really do with our knives.
Right.
And like fat, we want to improve tissue quality over the time. The filling and remodeling role has become for us a bit of a good collateral secondary effect.
Good. So, how do you know what filler to choose, and what are the risks?
Well, as you may know, in Europe we have a larger choice than
Right.
over here. Today, the fillers that I prefer are those who integrate better in our soft tissues. That means the skin and whatever is below, fat, fascias,
Right.
connective tissues. And the best ones for me are those who immediately after injection cannot be palpated. They don't behave as a foreign body.
Right.
They do integrate with tissues, again, exactly like fat. Fat cannot be palpated after injection. Some HAs, hyaluronic acids today, can behave in the same way.
Good. So, what about permanent fillers? I know you guys have a lot more choices than we do in the U.S., which may be good and may not be so good. So,
Yeah, you are absolutely right. We did have a lot of choices. I thank God for the fact that they are not legal anymore in Europe. There are many reasons why we see a lot of very late onset complications. In the paper that we wrote and your journal has gracefully agreed to publish, the average onset of problems, is between 7 and 8 years after injection. So whenever you hear data about 5 years safety, I'm afraid that some of the cases fall off these statistics. The big problem is that from the health point of view,
Right.
those foreign bodies can get infected during the rest of your life, even by very simple mishaps like a dental treatment that was a bit too invasive without antibiotic prophylaxis. Or the other problem is that they don't age as harmoniously as the resorbable ones,
Right.
together with the rest of their face. So even if nothing really goes wrong, we see a lot of patients that after 10 years have these permanent implants sticking out of their faces as if they didn't belong there. So we have begun, in Europe, the use of these fillers. I've never used them, but it has begun much earlier than here, and we see the very late problems. Right. These implants are for life,
Right.
like breast implants, but they're not as easy to remove in case of mishaps
Right.
as breast implants.
Right. Very wise words from Dr. Cassuto from Italy. Remember, permanent fillers may give you permanent problems. Use those that are integrated, like he mentioned, hyaluronic acid fillers. Thank you again very much. It's
Thank
a
you.
pleasure to see you.
My pleasure
You
and
bet.
honor.
It's
Thank you,
great.
Ron.
It's great.